Welcome to the online course, a WHO practical toolkit for antimicrobial stewardship programmes in healthcare facilities in low and middle-income countries. You may have several questions about antimicrobial stewardship. For instance, what does antimicrobial stewardship really mean? What about the structures that are in place for healthcare facility AMS programmes? Maybe you want to plan, perform and assess AMS programmes in healthcare facilities. Or you may want to know about the AMS competencies for healthcare workers. Find the answers to all these questions and more as you go through the modules in this course. Hello, I am Dr. Garcia, and I'll be your guide to help you understand the key aspects of antimicrobial stewardship, or AMS, in healthcare facilities in low and middle-income countries, or LMICs. Our time with antibiotics is running out. Antibiotics are in danger of losing effectiveness due to misuse and overuse, and in many cases aren't even needed. For decades, microbes have become increasingly resistant to various antimicrobials. Antimicrobial resistance, or AMR, has been recognized as a global threat to public health. The Global Action Plan on AMR that was endorsed by member states in 2015 has 5 strategic objectives. These objectives serve as a blueprint for countries to develop national action plans, or NAPs, on AMR. In this toolkit, we will focus on the 4th strategic objective, which is to optimize the use of antimicrobial medicines. Objective 1 is to improve awareness and understanding of AMR through effective communication, education and training. Objective 2 is to strengthen the knowledge and evidence base through surveillance and research. Objective 3 is to reduce the incidence of infection through effective sanitation, hygiene and infection prevention measures. Objective 4 is to optimize the use of antimicrobial medicines in human and animal health. Objective 5 is to develop the economic case for sustainable investment that takes account of the needs of all countries and increase investment in new medicines, diagnostic tools, vaccines and other interventions. This toolkit provides practical guidance on how to implement AMS programs which supports optimizing the use of antimicrobials in human health. The WHO Toolkit for AMS programs in healthcare facilities in LMICs provides guidance on structures, interventions and education and training for AMS in facilities. Structures refer to the essential core elements that should be in place to enable AMS programs at the facility level. That is, AMS team, clinical treatment guidelines and surveillance of resistance and antibiotics. Interventions focus on guidance on how to plan, perform and assess AMS interventions in a healthcare facility setting. Education and training focuses on the AMS competencies for healthcare professionals performing AMS activities, as well as different modes of delivery of education and training on AMS. Next, we'll take a closer look at the role of AMS. AMS forms an integral component of health systems. Stewardship is defined as the careful and responsible management of something entrusted to one's care. It was originally applied in the healthcare setting as a tool for optimizing antimicrobial use, termed antimicrobial stewardship. Stewardship has since been applied in the context of governance of the health sector as a whole, taking responsibility for the health and well-being of the population and guiding health systems at the local, national and global levels. AMS is important because AMS programs optimize the use of antimicrobials, improve patient outcomes, reduce AMR and healthcare-associated infections, and save healthcare costs, amongst others. According to the Organization for Economic Cooperation and Development, OECD report, Implementing AMS programs together with other policies to reduce overuse of antibiotics and promote hospital hygiene could save up to 1.6 million lives by 2050 and $4.8 billion per year in the 33 OECD countries. AMS is one of 3 pillars of an integrated approach to health systems strengthening. The other 2 are infection prevention and control, IPC, and medicine and patient safety. When applied in conjunction with antimicrobial use surveillance and the WHO Essential Medicines List, AWARE, Classification of Access, Watch, Reserve, AMS helps to control AMR by optimizing the use of antimicrobials. Therefore, in short, we can define AMS as a coherent set of actions to promote using antimicrobials responsibly. Let's look at the aims of an AMS program. Change behavior in antibiotic prescribing. Optimize antibiotic use. Extend the lifespan of existing antibiotics. Reduce the development and spread of AMR. Improve quality of care and patient outcomes. Save patients' lives and healthcare costs. Some of the key points that you need to remember are: avoid antibiotics when not needed. Prescribe access antibiotics when sufficient. Use newer antibiotics only when necessary. Since many countries around the world have developed and are implementing their NAPs on AMR, in which AMS is a key priority, there is a growing need for specific guidance on how to establish, implement and evaluate effective AMS programs. To meet this need, WHO has developed this practical toolkit for implementing AMS programs in healthcare facilities in LMICs. AMS programs can be driven through various processes and people. The key is to build on existing structures and to utilize entry points and champions. Let's look at the key steps to establishing a healthcare facility AMS program. The first step is to undertake a SWOT analysis using the checklist of healthcare facility core elements. In this analysis, you should focus on structures, human resources, antimicrobial use and resistance data, and AMS activities. The next step is to establish a sustainable AMS governance structure based on existing structures. Then you must prioritize the healthcare facility core elements based on the situational analysis. To do this, first identify the immediate priorities and then identify the resources required. The fourth step is to identify AMS interventions, starting with what you can easily achieve and is feasible, the low-hanging fruit. Here, focus on identifying the 4 W's. Who is responsible? What is the AMS intervention and where and when the intervention will take place? The next steps are to develop a healthcare facility AMS action plan that specifies the human and financial resources required, the AMS interventions to be implemented, and how to monitor and evaluate the effectiveness of the interventions. Finally, you should also ensure that you offer basic and continued educational resources and training on optimized antibiotic prescribing. Next, we'll go through a case study that illustrates how these steps are implemented in practice. But first, let's see how a healthcare facility in Barbados set up its AMS program based on an outbreak of a drug-resistant bacterium. The AMS program was established, linked to the existing IPC program following an outbreak of carbapenem-resistant Klebsiella pneumonia. Here, leadership commitment and having an AMS champion were key core elements to setting up the AMS program. You have reached the end of Module 1. Try to answer these questions to check your understanding so far.